Imagine a world where a scratch could kill. A world where childbirth was a life or death gamble. This was our reality before antibiotics. Minor infections, easily treatable today, were death sentences. The simplest ailments could decimate families and communities. A seemingly innocuous cut could quickly transform into a deadly infection. The threat of invisible microbes loomed large, casting a shadow over human existence. The discovery of penicillin in 1928 by Alexander Fleming marked a turning point. This miracle drug held the promise of conquering bacterial infections that had plagued humanity for millennia. Suddenly we had a weapon against these unseen enemies, a shield to protect us from their relentless assault. The impact of penicillin and subsequently other antibiotics was nothing short of revolutionary. Infections that once meant certain death became treatable. Surgeries previously fraught with risk became safer. The average lifespan increased dramatically. It was a new era for medicine, an era where we believed we had finally gained the upper hand against infectious diseases. The development and widespread use of antibiotics ushered in an era of unprecedented medical progress. Infectious diseases that had ravaged populations for centuries were suddenly brought under control. The fear that had permeated everyday life began to recede. This newfound ability to treat bacterial infections led to a surge in medical advancements. Surgeries, once incredibly risky due to the threat of post-operative infections, became commonplace. Organ transplants, previously unimaginable, became a reality. Chemotherapy, with its immune-suppressing side effects, became a viable treatment option for cancer patients. The discovery and widespread use of antibiotics revolutionized medicine, transforming healthcare and significantly extending human lifespans. The world embraced these wonder drugs, and rightfully so. Antibiotics became a cornerstone of modern medicine, integral to countless medical procedures and treatments. They provided a safety net, a sense of security that had been absent for generations. However, our reliance on these miracle drugs would have unintended consequences. The overuse and misuse of antibiotics have fueled a silent pandemic: antimicrobial resistance, or AMR. Use of antibiotics without proper diagnosis of bacteria and without prescription of doctor caused antimicrobial resistance. Misuse of antibiotics in animals and foods is also causing AMR. Each time we use antibiotics, we provide selective pressure on bacteria. Susceptible bacteria are killed, leaving behind those with mutations to survive. These resistant bacteria multiply and spread, passing on their resistance genes. Misuse of antibiotics accelerates this process. Taking antibiotics for viral infections like the common cold or flu is a prime example. A looming shadow, understanding the threat. Antimicrobial resistance, or AMR, is a complex issue with dire consequences. It occurs when microorganisms evolve to become resistant to drugs. This renders antibiotics ineffective, turning treatable infections into deadly threats. The implications of AMR are staggering. Simple surgeries could become life-threatening. Organ transplants and cancer treatments could become impossible. A minor cut could become a death sentence. This is the future we face if we fail to address AMR. By 2050, it is estimated that 10 million deaths will occur annually due to AMR. Urgent action is needed. We are already witnessing the devastating effects of AMR in healthcare settings worldwide. Infections that were once easily treatable, such as urinary tract infections, pneumonia, and tuberculosis, are becoming increasingly difficult to manage due to antibiotic resistance. Patients are experiencing longer hospital stays, requiring more intensive care, and facing higher risks of complications and death. The situation is particularly dire for vulnerable populations, including newborns, the elderly, and those with compromised immune systems. These individuals are more susceptible to infections and less able to fight off drug-resistant bacteria, putting them at a significantly higher risk of life-threatening complications. The rise of AMR also threatens to undo decades of progress in medicine. Surgeries and medical procedures that rely on effective antibiotics to prevent and treat infections are becoming riskier. Organ transplants, joint replacements, and even routine surgeries could become too dangerous to perform if we lack the antibiotics to protect patients from potentially deadly infections. Whatever is the situation, we together can prevent antimicrobial resistance. There is still a hope. Antibiotics should be taken only after prescription of doctor. The course of antibiotics should be completed even if we start feeling better before the course is completed. We can avert a global health catastrophe by acting decisively and collaboratively. As individuals, we must become responsible stewards of antibiotics. They are powerful tools that should only be used for bacterial infections, not for viral infections like the common cold or flu. Implementing robust infection prevention and control measures in healthcare settings is paramount. On a global scale, fostering international collaboration is essential. Reducing the use of antibiotics in animals and food production is crucial. Communities can work together by educating each other and promoting responsible antibiotic use. Prevention of antimicrobial resistance starts with awareness and collective action. Together.